Hi, I'm Dr. Nicole Vane in Moonlight Beach Dental, and I wanted to talk a bit about the advanced salivary testing we do in our office to test your oral microbiome. Now, when you go into the dentist, they're going to talk to you about plaque, tartar, bleeding gums, but they don't talk to you about what the root cause is and what the worst bacteria are. And the worst bacteria are related to numerous health issues, including heart disease, diabetes, infertility in women and in men, and colon cancer, other cancers, autoimmune, dementia, and Alzheimer's. All these things are related to the type of bugs in your mouth. And we test for the 5 worst ones. They're called red complex bacteria. And there's also another test we can do that tests for 11 to 28 of the bacteria called oral DNA, but a lot of times that's too much information. So we stay focused on the worst 5 and create a specific treatment plan for you on how we're going to treat those bacteria. Now, in dentistry, in general, you hear all these ads on TV for kills 99.9% of bacteria, but the oral microbiome is actually very delicate. Using an alcohol mouthwash or triclosan, which is in a lot of toothpaste, or even shifting to a week of heavy preservative-laden foods and fast food can shift your oral microbiome for weeks, months, or even permanently. So what we want to focus on is keeping the good bugs alive in your mouth and not using anything harsh or toxic to kill off the bad bugs. Because what we're doing is not only killing off bugs, and our mouth is full of bugs, but they're not all bad. We want to kill off just the worst ones, but we don't want to kill off everything, where only the worst of the worst survive and then end up propagating and creating more health issues. So there's very specific ways to do that. So when you come in, we do what's called an HR5 test, and you spit in a tube, we send it off, and we get the results back in about a week. And then we have you back and review those with you and your specific treatment plan. A lot of time what's included, and I have a little simple pamphlet here for patients at our office, is either a deep cleaning, scaling and root planing, where we're actually smoothing off the rough root surfaces, cleaning off any tartar, and also treating the pockets around the tooth with a laser. We can use a laser in different settings to kill the bacteria, either on a cutting setting or just a bacterial reduction setting. In this office, I also use ozone in all of our water bottles, fresh ozone, that also kills off not only the red complex bacteria, but also spirochetes and amoebas, which are very, very destructive. And then we'll make recommendations based on how you respond, because leaky gums, and what we see is bleeding, swollen inflammation, mirrors the gut. So leaky gums equal leaky gut, which is also something I focus on in this office. So if you'd like to know more about salivary testing, you can come on in, you can call us, you can get a pamphlet, or you can do a salivary test and we can go over those results, which are really, really powerful. And stay tuned for more videos on what those bad bugs are and what they do to your body.